We're breaking into your regularly scheduled programming to bring you the latest update from the governor on the coronavirus. We do want to let you know that we are under a severe thunderstorm warning for portions of East Baton Rouge Parish. You can follow along with the radar at the bottom of your screen, but we're going to take you live now to the governor.
And be available for your questions. We shifted to a press briefing today because we have also shifted our UCG meetings to twice weekly. Those will be held on Tuesdays and Thursdays, and so that's when we plan to have our press briefings going forward as well until we make some additional changes. And we will not have one tomorrow. We've been having them on Wednesday, but the next one is scheduled for Thursday. Today, we are reporting 1,737 new cases of COVID-19. This is 583 total since the beginning. That is 2.08% of our population. That is number 2 in the country per capita for cases, and it is extremely close to number 1, which remains New York State, but they're at 2.1% of their population. We're also reporting 36 additional people have very unfortunately passed away in Louisiana because of COVID-19. That number is the most in a single day since May the 28th. That brings the total number of deaths from COVID-19 to 3,498. 1,527 individuals are hospitalized. That is the largest number since May the 3rd. 186 of those are on mechanical ventilators. With respect to tests, in the month of July, we have now exceeded 374,000 tests. Our monthly testing goal, which is a minimum goal, is 200,000. We are just about at twice that number already, and it's the 21st of July. So we're certainly doing a lot of testing in Louisiana. That's a good thing. I'm never going to say we're testing as much as we would like, because we'd always like to test more. We still work on things like getting the turnaround time from the labs reduced and that sort of thing. But our testing effort, I think you'll find, is at the top of the country in per capita tests, and especially for the increase in testing in the month of July. Overall, we've done more than 1.1 million tests in the state of Louisiana since the beginning of the public health emergency. Speaking of tests, at the test surge sites that we have set up, as of yesterday, we've tested more than 33,000 Louisianans since the start of that surge testing. And this is testing that was brought to Louisiana to be testing above the baseline in order to extinguish what the White House Coronavirus Task Force, Dr. Birx, Dr. Giroir, considered a hotspot of national concern. And there are 5 main sites in the East Baton Rouge Parish area, 4 of those in East Baton Rouge, and that's F.G. Clark at Southern, Alex Box at LSU, Cortana Mall in Baton Rouge here, obviously Healing Place Church, and then Ascension Parish at Lamar Dixon. There are also a number of mobile testing sites that are part of that surge testing effort around the capital region and elsewhere in South Louisiana. Some mobile sites will operate multiple days, like at Cajun Field in Lafayette. And today we're adding a fixed site in Alexandria at the Rapides Coliseum as part of this surge testing effort. This effort is going to be short term, but we now believe they will be open through the end of July. It's until we exhaust all the tests that have been made available to us from the federal government for this effort. We think it'll take us through the end of July. It is not necessary to pre-register, but if you want to pre-register, you can. You go to doineedacovid19test.com to pre-register. Remember, it's no cost to the individual. You can test because you have symptoms or because you've been in contact with someone who has COVID-19, or if you're totally asymptomatic and just are concerned that you might have it. You can be tested. Apparently, some people are getting emails saying that they need to retest after they've received the result from these surge testing sites. This occurs because people will register more than once, but they only test once, and so as the system tries to reconcile that, it'll send a notice out to the individual to come back and be tested. However, they don't, once they get a result, they don't need to go back and be tested. But what we are asking people to do, if you choose to pre-register, only register once. Because you'll be confusing the system if you register more than one time. Community spread is still a major problem in Louisiana. We are seeing high incidences of COVID-19 all across our state, as defined by the CDC, of more than 100 tests per 100,000 population over cases, I should say, not tests, over a 14-day period. We're also seeing positivity factors well in excess of 10% across the state of Louisiana. About a third of the tests that are coming in positive any given day recently are coming from those who are 29 years old and under. And somewhere around 90% of the tests today were from the community. Only 10% or 9% or something like that was from congregate setting, just to let you know a little bit more about what we're seeing. I would take I don't know if we're going to a different graphic now or not, but as of the 15th of July, all regions of our state had a 7-day average percent positivity of greater than 10%. The most recent is 15.46% positive. My biggest concern are hospitalizations per capita over the last 14 days. They are in an upward trajectory in all regions of the state of Louisiana. This is a particular concern because we know that there are only so many beds, there's only so many nurses and doctors and so forth, and the ability to provide life-saving care is critically important. And again, that's true for COVID patients, but it's also true for all patients, whether they have a stroke or a heart attack or motor vehicle accident, that sort of thing. As of the 16th of July, all regions are showing a downward trajectory in average incidences of cases. We believe, and you're going to hear more from Dr. Biu in just a minute, that this more likely than not represents a lag in the receipt of test results over the last week, and that as those test results come back, you're going to see those incidence rates go up. Also, all regions as of July 19th have and are not the effective reproductive rate of greater than 1, indicating that COVID infections or requiring hospitalizations are in fact increasing across the state of Louisiana. So I'll share all that with you, and to sum it up this way, we still have a lot of COVID-19 in Louisiana, more than we want, and it is widespread all across our state. This resurgence of COVID-19 doesn't look like it did back in March and April, where it was concentrated in certain areas, mostly the densely populated areas around Orleans and Jefferson Parish, and later in Baton Rouge and up in Shreveport, but it is widespread across the state. Which is why I'm announcing today that I will extend Phase 2 order for an additional 2 weeks. As you know, the current proclamation goes through this Friday. So on Thursday, I will sign a new proclamation that will become effective Friday that will extend us in Phase 2 for an additional 2 weeks. That'll be until Friday, August the 7th. We will continue to look deeply into the data over the next few weeks to figure out where we go from here. And at this time, I'm going to turn it over to Dr. Biu to get a little deeper into some of the information around tests and hospitalizations and so forth, and then I'll come back up. I would ask you that to the extent that you can, if you've got a question for Dr. Biu, you might want to ask it while he's up here, and then I'll come back at the end and make some additional comments, and then I'll take your questions. Thank you.
Thank you, Governor. So just to reiterate some of what was just said and what you can see up here on our slide of our gating criteria, What we're seeing is really a statewide issue at this point with COVID. We've talked about regions at different times, and when we first, if we go back to May, when we first started sharing getting criteria, we had specific regions that were maybe not going in the right direction, and even then, it wasn't necessarily all criteria rather that weren't going in the right direction. So you might have a region that was having increased cases or cases and hospitalizations, but not really seeing almost all three of them going up at the same time. Right now, we're in a different situation where we're just seeing a tremendous amount of COVID and a tremendous amount of spread of COVID across the state. As the governor noted, you can see that first graph in the upper right-hand corner. The upper left-hand corner, that is showing even the people showing up to emergency departments with symptoms of COVID are increasing, in some regions steadily increasing. As you're seeing here statewide, it increased and is staying elevated compared to other reasons people are coming to emergency departments. If you look down then at the graph below that, you see that our testing has increased dramatically over time. And initially, there was a decrease in those yellow bars showing the percent positivity to where we got as a state below 10%. And now we've been steadily climbing, surpassing 10%. And as you heard from the governor, most recently at 15.46% as of the 15th of July. And that's higher than we want to be and shows that we're not just seeing changes in testing. What we're seeing are real changes in the number of people who are being found positive, having COVID when they're tested. And then that's reflected in the graph of our new cases, yes, in the upper right-hand corner. Did I reverse that again? Yeah. No, you got it. Okay, good. So as you see the red bars there increasing, especially as we get closer in time, and then at the very end turning green. Green meaning that we're seeing a decreased incidence. But again, as the governor noted, when you have a delay in test results coming back, as we're seeing now, where some people are waiting 7 days, 10 days, we've even heard as much as 14 days for test results to come back, that period of time when we can rely on those test results coming back and that true incidence is pushed back further. So what that makes me concerned about is that in the coming days, those green lines are going to be filled in and become red, and we'll see that steadily across the state we continue to see increased numbers. And again, our daily case counts would indicate that. In the last week, we had been seeing routinely numbers north of 2,000. Yesterday, we had, if you just look at new cases, not those backlog cases, a little over 1,500. Today, 1,700. So these are high levels of daily cases to be reporting, and so I think we'll continue to see that incidence is high. But most concerning to me, and I believe to the governor and to many of you, is the last graph, which shows what's going on with hospitalizations, where we've now clearly turned a corner in the wrong direction and are steadily seeing a rise in cases in hospitalizations statewide, where we're seeing more people being admitted with COVID across the state. And I just had a call earlier today with members of LDH and the medical leadership from across the state, the hospitals across the state, and everybody emphasized their same concern that they're seeing hospital capacities becoming more and more strained, not just because of COVID, but certainly with COVID driving a fair bit of new admissions, but also people who delayed care because of concerns of COVID now coming in sicker and needing admission to the hospital because whether it's their heart failure or their breathing difficulties, those things are now requiring them to be admitted. And so when you have two reasons for people to be coming in the hospital and be admitted, it puts a lot of strain on those systems. Along those lines, I'd like to look at two specific regions. So we'll start with Region 4. Region 4 shows a very similar pattern to what I just showed you at the state level. Again, elevated COVID-like illness. You see that's a really high level of COVID-like illness that we had been seeing recently. Testing, though increased, still shows high levels of percent positivity, those yellow bars. And then cases that certainly had been on the upswing, and again, I have every reason to believe that we'll continue to see those fill out over time and be elevated. But most concerning there is the hospital pattern in Region 4. So that's the greater Lafayette area. And what you're seeing is that the level of hospitalization is nearly double. It's really exceeding what they saw in that first wave of hospital admissions that we saw back in March and April. And now we're starting to hit a point where several hospitals are having difficulties admitting patients and seeing patients in their emergency departments and are having to send them to neighboring hospitals, and sometimes patients are having to be shifted to other regions where there's more capacity. If we look at Region 5, we see the same pattern again. A lot of people showing up to the emergency department with symptoms of COVID. That's translating into a higher level of percent positivity, translating into, again, a very steep spike in the number of cases. More recently, sort of flattening and maybe decreasing. We'll see if that stays steady. But with hospitalizations taking a sharp incline and, again, being around double what had been seen in the previous epidemic. And so in addition to staying in phase 2, we also very much support the measures that the governor took Monday a week ago in putting in place a mandatory masking mandate for the state. As you heard, we're now in a situation where every parish across the state has more than 100,000 or more than 100 cases per 100,000 in the last 2 weeks, which was the threshold for that mandatory masking mandate. But also importantly, shutting down potential hotspots of transmission like bars and reducing crowd gatherings. Most importantly, communicating to all of you the power that you have to help us stop the spread of COVID by wearing your mask and being very thoughtful about where you're spending your time and how much time you're spending around others outdoors. Again, would strongly encourage you to, even if you're wearing a mask, limit your exposure to people in under 6 feet distance, and certainly be wearing a mask anywhere you go. So we're hopeful that with those measures, we'll begin to see, in a week's time, a leveling off of our cases, and hopefully see some decreased pressure on our health systems. In the meantime, we continue to meet with our hospital system leadership to talk about the steps that we can take in collaboration and with help with the federal government to ensure that we're able to open capacity, we're able to have adequate staff, and address what we're seeing showing up in our hospitals across the state. So with that, I'm happy to take any questions that you have. Please.
Wasn't clear, but is the governor also extending the mask/bar that order as well 2 weeks?
Yes, sir.
So 2 weeks coincides really closely with the opening of schools, K-12 here. Does this affect any sort of advice that we're seeing in phase 2 for 2 weeks that you would give schools as they open?
I think from our perspective, we're still very much looking on a daily basis at all sorts of information. What we're seeing from the CDC, because we still don't have definitive guidance from the CDC at a national level on what should be done for schools. But importantly, as with any guidance that we've received, whether it's from the CDC, the White House, or anybody else, we have to look at the context of what's going on in our state. So it'd be a very different situation if we see that we're starting to have cases decrease, that we're starting to see the measures that were taken a week ago have impact, versus things are continuing to stay bad or worsening. So I think that it's too early to say from my perspective what our recommendation will be. But again, we look at the data every day.
If we're 2 weeks out from the start of school?
Well, so the recommendation on when to actually move forward with schools, I think, will be one that's had with the governor, with the Department of Education, and certainly with local education leadership. What I'll say to prepare for that, though, is all the work that we've been doing now for over several months, actually, with school leadership, with the Department of Education, to plan so that we know what would be the things that we would put in place if schools were to open, should leave it really down to what is the timing that schools open. We know that local leadership is also considering that data as well, but we want to make sure is that what school would look like, that and those planning phases, that's all been completed and continues to be revised and revisited. When that actual trigger is pulled for actually reopening the schools is one that I think has to be based on what's going on the ground.
Hospitalizations rising. I asked the governor about cutting off those non-essential procedures again. He said some regions were looking at possibly, what they could and couldn't do, but he hadn't heard from the Office of Public Health yet on the statewide perspective. More than a week out now, as hospitalizations continue to rise, from y'all's perspective, what do you see as far as the impact of maybe those beds of non-essential procedures across the state?
Yes, I'll say right now we are regularly in communication with hospital leadership, and they are dialing in capacity depending on where they are and what they're seeing as far as admissions, especially those procedures that will result in an intensive care unit stay, even if it's just an expectation that after surgery you might spend a day recovering in the intensive care unit. We're seeing some hospitals defer those surgeries if they're not necessary and really try to reduce those elective procedures. Keep in mind, another, quote unquote, sort of elective visit would be going to see your outpatient doctor for your blood pressure elevation. So if they can do that, if they have capacity to do that, we want people to be getting the regular maintenance care, because that is going to be a core thing that's going to reduce some of the strain on the hospitals. Somebody who's getting outpatient care for their congestive heart failure is somebody who's not going to get admitted to the hospital and need potentially either a medical surgical bed or an intensive care unit bed. So right now we are sharing information on a regular basis back with hospital leadership. We're in regular dialogue with them and helping them do what they do best, which is dial in their ability to maintain operations and keep the populations that they serve safe.
So the decision's being left up to hospitals on individual facilities?
Yeah, so right now the hospital leadership are making those decisions with our support, and certainly we have not seen any decisions that we're aware of that we wouldn't support at this point.
We've heard a lot of the problem, especially with the ICU units, is nurses, not so much bed. Is the state doing anything to try and encourage more nurses? Has there been any discussion about pulling down some of the Navy medics who came a couple of months ago to help us to try and boost the staffing in hospitals in addition to fixing the bed problem?
Yeah, I mean, I think if there's any sort of benefit to being in the position we are now, it's that unlike maybe many of our neighbors, we've been through this before. So we have a variety of different tools that we are ready to reactivate, and some of which, again, hospital leadership are already activating individually because they have experience. So like you say, there's bringing in staffing contracts from other parts of the country that aren't as affected. In our neighborhood, certainly, most states in the Sun Belt are affected. And so we're seeing that the ability to have neighboring states shift their staff probably is not going to be available to us. But we're in regular communication with federal government. We've been elevating requests for additional staff to the federal government, and we're hopeful that when needed, we could have that support as well.
A lot of schools start on August 6th, and a lot of them are a combination of in-person and remote. Would you tell those school leaders to proceed as they are based on the numbers you know? Or would you tell them that they should be thinking about basically halting everything for a month or so or until after Labor Day because the numbers are not what we want them to be?
So I think it's a nuanced question or a nuanced answer. I think nobody wants to hurt education and impact education. It's really critical for our students that they get back to learning. We know that this is going to be a challenging school year regardless. And so we don't want to do anything that's going to make that more challenging. We also know that it's not a minor decision to just switch from virtual to in-person. Gearing up for in-person, having to switch last minute to virtual, or making sure that everybody by 2 weeks' time is ready for virtual learning. So I think what we've been doing is having broad-ranging discussions with the Department of Education. The Department of Education, I'm sure, in turn, has been having broad-ranging discussions with schools to make sure that they are doing parallel contingency planning and preparation so that whatever the situation is in their particular region, they're able to provide some sort of education and continuity for students. But to my knowledge, at least in the Office of Public Health, we don't have a switch where we're dictating when schools start or not. We're trying to provide information to the governor and the Department of Education that they're providing to local leadership.
On the subject of hospital capacity, do you know what the situation is at the convention center in New Orleans at this point? And are y'all considering either trying to expand that facility out more, or do facilities like that sort of surge facility in other parts of the state where you're seeing these problems?
So we still have capacity at the Morial Convention Center, the medical monitoring station there.
Do you know how much?
Off the top of my head, I don't have those numbers, but the governor can answer those for you. Maybe he can give you sort of the broader strategy as well. But what I'll say is we're looking at a variety of different opportunities. Keep in mind, the medical monitoring station is really for people to decompress the hospitals when they're reaching capacity, less so for new acute patients. And so that weighs into thinking about what hospitals need to do. If they're seeing lots of new acute patients and not yet having a decompression issue, we need to make sure that they're adequately staffed and supported to expand their capacity in the hospital versus expanding medical monitoring, where They're just having people that are staying in the hospital longer. One thing that's different now versus the beginning is we've learned a lot about how to care for COVID. We have new treatments, remdesivir, dexamethasone, convalescent plasma, certainly in our urban centers. And again, would encourage the public, if you have recovered from COVID-19, to consider donating your plasma because that will help the next group of folks. But so that changes the length of stay for people in the hospital, how acute they are when they show up in the hospital. Then we're still at a relatively low level of people requiring mechanical ventilation. So how we respond this time may be a little bit different, but we do still have significant capacity at the medical monitoring station. And whether that needs to be duplicated somewhere else, I think would depend a lot on the reality on the ground in those regions.
We've heard from a lot of different people who have had vastly different testing experiences at the service sites in Baton Rouge. For example, a swab of different sizes at Healing Place versus Cortina, guardsmen counting down at one facility but not at another to see how long the swab is in their nose. How confident are we that these tests are accurate, and why is there not a uniform procedure for the way those tests are conducted?
So the materials may be slightly different depending on the way that particular site is being supplied. I'll tell you that we are using a standardized protocol across those sites, and so even if the swab seems to be slightly different in diameter, everything has been validated. So it's probably just a matter of, when you're talking about trying to do 5,000 tests a day or such a large volume, that you're having to use a variety of different swab types at different sites. As far as the experience of the individual, it may be that one person counts out loud, the other person's counting in their head. I can't speak to that, but I can tell you that we're using a uniform procedure, and by and large, again, these are guards people who are doing this work, and one thing that they do really fantastically is drill and perform protocols together. So you may have a slightly different experience based on who's the person that you're with, but the protocol is uniform, and the place where the samples are being tested is uniform as well. Maybe I'll take the last. Yeah.
I'm sure you explained this and I just didn't get it, but as far as I know, school is planning to open for in-person learning for schools and colleges in a couple of weeks or within a month. In your medical opinion, is it safe for those children and teachers to go?
So that's not a question about when they open. Is it safe for schools to operate in general? And there's just not an easy answer to that. When we look at kids, we think that by and large, children, though they certainly can get COVID just like anybody else, they're at lower risks for poor outcomes from COVID. We're seeing a surge in individuals in a younger age group right now, and we're not seeing as many of them get as sick as if they were 60 years or older, but we're still seeing, even though they're generally healthier, even those individuals are going to the hospital more often now because there's just so many more of them. Statistically, if you double the size of that population, even if it's a small number of that population that's needs to be hospitalized, you're going to double that population too, right? So what we don't want to see, even though kids are at lower risk, is a large number of kids that suddenly have more health problems because of exposure to COVID. But by and large, kids are probably safe. The challenge, as you noted, is they have to be around teachers, and they go home to caregivers, adult caregivers. Sometimes that's exposure to people who are over the age of 60. And so all of that has to be balanced. How do we operate school in a way that it reduces the likelihood that any one student, were they to become have COVID, would spread it to other students? How do we ensure that the teachers are kept as safe as possible? How do we reduce the likelihood that we have poor outcomes as a result of this? And so medically, there's no easy answer to say, yes, you have school, no, you don't have school. What we can say is education is critical. We need to be able to do this work, whether it's in person or virtual. And what we need to do from a public health standpoint is give advice on how to reduce the risk to the public as much as possible. And with that, turn it back to the governor.
Thank you, Dr. B. And I'm sure all of you will recall that when the Board of Elementary and Secondary Education, it was just a little over a week ago, I guess it was not quite a week ago maybe, they came up with their guidelines for our school districts. They did it based on a variety of contingencies, primarily whether we're going to be in phase 1, phase 2, phase 3 when they open, and how those schools would operate if the phase changes, whether it goes up or down. And so they worked on guidelines, and so at the end of the day, school will open, and whatever phase we're in, that's how schools are going to operate. And you have school districts now making the decision as to exactly when they're going to open for instruction, whether when they open initially, that is for in-person instruction, or whether that comes later. I think you're starting to see where some school districts are going to open on time, but perhaps for distance learning, and then transition to in-person education right after Labor Day, and so forth. So you're going to see a variety of approaches by our school districts with respect to how they open and when they open for in-person instruction and so forth. But I will tell you that the Board of Elementary and Secondary Education, Superintendent Brumley, coordinated all of their planning with the Office of Public Health, with the CDC guidelines, to make sure that we're doing things as safely as we possibly can, which is why they included, by the way, as part of the guidelines, a mask mandate. Dr. Redfield, the head of the CDC, said on the White House Task Force telephone conference week before last that where you are going to open schools in states like Louisiana, where you still have more COVID than we would like to have, that mask usage is incredibly important. He talked about universal mask usage. That's reflected if you take a look at the plans, that the guidelines, I should say, that came out of Bessie. With respect to staffing, I think there was a question about staffing. Week before last, I participated in a call with 18 to 20 hospital CEOs and medical directors. They identified 3 primary concerns that were almost uniform across the state. They dealt with making sure they had adequate access to remdesivir, making sure that the testing turnaround times could be decreased if possible, and thirdly, it was about staffing. And so we started talking to those hospitals that were raising the staffing issues at that time, and when the Vice President was here last week, we raised that issue with him. I will tell you, we have submitted through FEMA requests for medical personnel of various types, ICU nurses, other nurses, doctors, and respiratory therapists, and so forth. That request is pending. We are also looking at other options like contracting with medical vendors, if you will, to bring in staffing here in the state. And so it's not, it's a difficult thing to do because the medical professionals are needed where they are. And with the need being so acute and widespread, it's hard to get them into Louisiana, but we are working various angles to try to make sure that if we can provide staffing relief for these hospitals. With respect to the Morial Convention Center, I know there was a question about that. Right now, it is set up with 250 beds. There is staffing on hand, so that if 60 of those beds are occupied by patients, we have adequate staff. We do have the ability within a very short time period to provide additional staffing through a contract that we have with a vendor for an additional 60 beds for 120. Today at the Morial Convention Center, we have more than 20 inpatients. And again, these are the less acute patients. These are the ones who don't require an ICU, they don't require a ventilator, but they're not well enough to go home. And so the goal here is to keep them out of our hospitals in order to free up the capacity for the hospitals. So that's where we're at with the Morial Convention Center. And I apologize if I wasn't as clear as I intended to be when I indicated that we would stay in phase 2 where we are for another 2 weeks. That is going to include the changes that we made that became effective last Monday with respect to the mask mandate, the bar closures, for on-premises consumption of alcohol. You know, they still have the ability to do drive-through if they have that, and curbside pickup at the bars, but also the limitation to 50 on the gathering, social gathering. the number of individuals who can do that. So that will all stay part of the order. We will go another 2 weeks. Really, 1 week is not enough time, as you know, to determine the success or not of various mitigation measures, because it takes longer than that. Once the behavior change occurs, it takes some period of time before that shows up, hopefully, in decreased tests and so forth. So we're going to go another 2 weeks and see where we are. The good news is that there's modeling recently that's been done by the White House Coronavirus Task Force, and Dr. Birx mentioned this last week to us several times, where we don't have to go back to phase 1 or to phase 0 in order to flatten the curve again and see fewer cases, fewer hospitalizations, and obviously, ultimately, fewer deaths. We can get to a R0 of less than 1 if we will wear masks. Everybody wear masks. That's why we have a mandate. And in fact, one of the things that she said was, when you have a widespread high incidence of COVID like we do in Louisiana, when you have positivity exceeding 10 in the overwhelming majority of your parishes, only a centralized state mandate will work. But in addition to that, based on all the evidence, you do have to close the bars, and that nobody wants to do that because we know that that visits hardship on bar owners and other employees of bars, but it is essential if you're going to get the curve flattened again. And then finally, you have to decrease the crowd size. And that's why we're talking about social gatherings, no more than 50 people. Doing things outside when you can, staying physically distant from people, washing your hands, staying home when you're sick. All of these things continue to make a tremendous difference. And it also is still the case that you are safer at home than anywhere else. And so while we are in phase 2 and the stores are open and so forth, it doesn't mean that you have to go to the store every day, you know. And if everybody would decrease the number of times that they're out and about, then they're also decreasing the likelihood that they are going to become infected and then ultimately infect other people as well. So obviously, none of the decisions we've made have been made lightly. They're all been based on the data, the best science that we have, and on the White House guidelines. We know that there are a lot of people who are in need here in Louisiana and around the country. You know, one of the things that certainly caught my attention, and we knew that there was more need than we could initially fund, but the rental assistance program that we unveiled last week. We've identified $24 million to fund that initial effort, and that's for about 7,500 people or so, but we had more than 40,000 who signed up. Not all of whom are going to be eligible, but we had to obviously stop taking additional applications, and then we're working on funding the remainder of the need as best we can, looking at community development block grant funding and other ESG allocations, which are forthcoming. The legislation that made those appropriations has already passed, but HUD has not yet made the funding available. We know that they will, and relatively soon, and because they're using criteria like per capita case counts, Louisiana is one of those states that will be able to take advantage of those programs. We are going to continue to look to other CARES Act funding, and then, of course, Congress is already talking about phase 4 legislation, and we don't know what that will entail. It's taken shape even as we speak, but hopefully there will be some rental assistance funding that becomes available through that legislation as well. And I do encourage anyone who would like to receive notice about when those additional rental resources will become available to sign up at larenthelp.com, larenthelp.com. On the Frontline Worker Program, we have about 189,000 applications. There's funding available for 200,000 individuals. Clearly not all 189,000 people who applied are going to be eligible, but we assume the vast majority of those will be, but there's still some room there for people to apply. I would point out that we have paid out, about 2/3 of this has been federal money, but $4.8 billion in unemployment assistance, the unemployment compensation, the pandemic unemployment assistance, and so forth. And everyone realizes that the $600 weekly benefit is set to expire on July 31st. One of the things that Congress is talking about right now in phase 4 is whether to extend that, and if so, in what amount of weekly benefit. And I know that the uncertainty on top of the difficult situation that people are in causes a tremendous amount of anxiety, and I am aware of that. We're going to continue to work as hard as we can to make available all of the assistance that we can get our hands on. We did see a drop in unemployment in Louisiana. We're thankful for that. Dropped to 9.7%. It dropped by 4.5 points. But there's still an awful lot of unemployed people. We know that. And that's especially true when you consider where we were in terms of our employment numbers before the pandemic. But I want to stress again, the best, fastest, surest way to get more businesses open, more employees back to work, is to flatten the curve and get a handle on this virus as best we can and get the cases and the hospitalizations trending in the right direction. And at great risk of sounding like a broken record, we have to do the things we've been talking about all along. You got to wear your mask. You got to social distance. You got to wash your hands frequently. Stay home when you're sick. We know it works. We've done it before, and we can do it again. I have tremendous confidence in the people of Louisiana that we're going to get back on top of this. I'm going to take questions here in just a moment, but unfortunately, there is a tropical disturbance that we need to talk about for just a moment. It is located on the north side of Cuba. It's expected to move into the southeastern Gulf of Mexico later today. Has a 40% chance of further development over the next 5 days. Current tracks take that system, that disturbance, towards Texas. However, even with the current trajectory or tracking that we anticipate, southeastern Louisiana could begin to experience wind and heavy rain starting on Wednesday. And as weather experts always warn, don't get locked in on the forecast cone because the impacts can be felt outside the cone. And the cone is only right a certain percentage of the time, and sometimes that storm will move entirely outside of the cone. So please stay tuned for updates as the track and the strength of this system may change. And if you haven't done so already, please visit getagameplan.org to make sure that your family is prepared. And if you've grown accustomed to getting a game plan and you've just done what you've always done this year, understand that because of COVID-19, your game plan needs to be a little different. And so go to getagameplan.org, and it will share with you information that you need to take into consideration, supplies that you need to have available that you didn't have to have in previous years. Finally, I'll remind people that yesterday I invited folks around the state who were like-minded to engage in prayer and fasting, the fasting during the lunch hour, and that continued today. And of course, I'm asking people to do that tomorrow as well. So it's 3 days of prayer and fasting for our state, and particularly for the COVID-19 public health emergency, for those individuals who are sick, that they will be healed, for the caretakers, that they will have the grace and the courage and the stamina to continue to do the heroic work that they've been doing, for family members of those who've died, that they will find comfort and peace, and that the state as a whole will come together and understand that the virus is the enemy. We are not one another's enemy here in this particular situation. So with that, I'm going to pause and take your questions. Yes, sir.
The Attorney General had great differences over the past week about these orders. Is he still participating, or is designee in the United Command Group meeting?
The Unified Command Group meeting, yes. The UCG meetings, he is not, to my knowledge. There is an individual from the AG's office on all of our calls. They get an opportunity to brief, and certainly they get an opportunity to listen to the daily updates that it relates to testing and cases and deaths and hospitalizations, positivity factors and high incidence, all of those sorts of things. But he has not personally participated, to my knowledge. He may be listening on the other end of the call, but he's not participated. Yes, sir.
Governor, I wanted to go back to schools for a second. I know you mentioned it when you came at the podium, but on Friday, Ascension Parish Schools announcing they've delayed for a week. New Orleans going all virtual until at least Labor Day this morning. East Baton Rouge Schools just announcing a press conference tomorrow. As cases continue to surge and no indication as of now that they're going to go down right now, is it kind of inevitable that we're seeing schools start to consider more virtual options with cases still hovering as they are?
Yeah, and I think they've been looking at those options all along, trying to get the mix right and figuring out how many students they want on campus and how many to do distance learning and what the hybrid situation would be, where students engage in some in-person instruction and some by distance, and then certainly when to start that. And so you've got all these school systems out there working extremely hard. They're consulting the guidelines that they were given by the Bessie board in the emergency rule that got promulgated last week. And they're going to make decisions that are in their best interest, and we're going to try to work with them and resource them as best we can, whether it's PPE, additional information, you name it. But obviously, this is a very difficult task that they have. We've not been through anything quite like this before, and our school districts are learning from one another, and we're learning from other states and so forth. Obviously, the goal is to safely get kids back in the classroom to the maximum degree that we can. And you've got to balance, just like we're balancing public health with the economy. You also have to strike the right balance between public health and the education of our kids. And that's what we are trying to do, using science, using the best information we could get from the CDC and so forth. And that's what we're trying to do with our schools. And you know, I will tell you, I've had a number of conversations with Superintendent Brumley, and he and I continue to be impressed with the degree to which the effort, I should say, that our school districts are making in order to be able to do this safely. And I think it's only natural that if you've got high incidence rates, high positivity of test results across the state of Louisiana, you're going to see some school districts elect to do some more virtual early on, start the in-person a little bit later, and that's flexibility that they all have. And we're going to, I think over the next several days, we're going to see a number of school districts make those types of decisions and announcements. Yes, sir.
You have no expectation, as you did in March, and then later into the rest of the semester, you have no expectation to step in and kind of make a statewide decision on when kids go back to school?
No, and look, I'll go back to what I said earlier. The Bessie board came up with guidelines based on whatever phase of reopening we are in when school resumes, and how that school is going to operate for the remainder of the year, depending on what phase we are in at any given time. And so there's a broad range of contingencies there. And it informs everything from how many kids can be on the bus at the same time to how many can be in an individual classroom at the same time, and how different school activities are going to function and so forth. And so we're going to make the decisions here at the governor's office about what phase we can be in based on the gating criteria that we've been asked to look at, and we're going to make that announcement as early as we possibly can, and then the school districts are going to respond to that. I will tell you that over the next week or so, I intend to meet with a variety of stakeholders in our school systems in order to make sure that I'm receiving their feedback, and as they develop additional concerns or whatever, that they can share those with me. This is not an easy situation for any part of the state of Louisiana, and I guess that's especially true for education as we get closer to resuming the schools in the next school year. Yes, ma'am.
So we're in phase 2 until a few days, maybe even a couple days before school start. Should schools prepare as if they will be in phase 2 when they open?
Well, schools have to be prepared to open in whatever phase we're going to be in. I cannot tell you today where the state is going to be 3 weeks from now, 4 weeks from now, 5 weeks, because it's going to be dependent on the data that we get between now and then. What I can tell you, if people will do what we're asking them to do and wear their mask and socially distance and wash their hands and stay home when they're sick, we know that we're going to bend the curve again and we're going to be in better shape. But I don't know what that looks like on a date certain that's out in the future, which is why the schools did what they did, and they came up with guidelines that deal with each phase of reopening. So if I were a school superintendent right now, knowing that we are pausing in phase 2 for the second time, and it's only a few weeks before school starts, I would probably start working. Most of my concerted effort would be to start school in phase 2. But I cannot guarantee we're going to be in phase 2 then because I just don't know what the data is going to be like. It is my hope. And quite frankly, it's my expectation that we don't go backwards. But we will do what is required to make sure that we don't exceed our capacity to deliver life-saving care in our hospitals. Yes, sir.
There were a number of recommendations from the White House that were not included in the current executive order, closing gyms, limiting crowd sizes to 10, moving seating outdoors at restaurants. Now that we've had a chance to see those recommendations and perhaps amend the executive order, why not further tighten restrictions to bring our state's rules in line with what the White House recommends?
Yeah. Well, first of all, the biggest part of the recommendations were things that I did before the White House officially revised the guidelines, although they were telling us that we needed to do the mask mandates, close the bars, and so forth. I will tell you, and we're looking to get further clarification on this. For example, whether to be at 25% in occupancy in our restaurants or 50%. We say it's up to 50%, but you've got to be able to socially distance with those who are not part of your immediate household. So we believe that the modeling that says 25% is really based on the ability to social distance, which is part of our current restriction at 50%. So we don't feel the need, unless we get further information, to change from 50% to 25%, because either way, we are requiring restaurants to ensure that people are adequately social distancing. I don't know whether we've had any contact tracing that suggests gyms are an issue, and perhaps we have, but it's not. Yeah, so it's not something that we've experienced as being a problem here, unlike bars, which were the number one venue where outbreaks occurred, and the total number of cases was by far the highest, were traced to bars, even though, and this is why what the White House was saying is correct, and Dr. Birx is correct. That's true even though bars were completely closed down in phase 0 and phase 1. They only opened when we got to phase 2, and they're still driving more of the outbreaks and the cases that we can trace back through contact tracing than any other venue. So that's why we're keeping the restrictions we've already put into place and the mitigation measures that we added this past Monday. Going to give it 2 more weeks to see where we are. And look, if we continue to learn things that suggest that we need to take additional measures, or that we can ease restrictions on certain venues, we're going to do that as well. We're working as hard as we can and as transparently as we can to use the data, use the guidelines to strike the right balance here in Louisiana. Well, I'll do 2 more.
I asked Dr. Beebe this, but I will also ask you.
So you didn't like his answer?
Well, he kind of punted a little bit to you on this one, which is in terms of the additional healthcare facilities like the convention center. Is that something you are considering or eyeing doing in any other parts of the state, of trying to set up some temporary facilities because of the hospital?
Well, everything is under consideration, but we would have tremendous difficulty staffing new facilities that are constructed, that are created outside of existing footprints of our hospitals. And so that's not our first effort. One of the things that I'm really happy we made this decision several months ago is a number of hospitals around the state of Louisiana created additional capacity for surge beds and ICU beds that is permanent. And it greatly exceeds what it was. And I don't have the figure here at my fingertip, but I think it's on the order of like 350 beds around the state of Louisiana that are in existence today that didn't exist before. And that's going to help us. Secondly, at LCMC, they have a couple of hundred beds that are not ICU beds, but they put them in a negative pressure environment so that they can be quickly transitioned to ICU beds. But we're still going to have to figure out the staffing. But staffing is inherently easier within existing hospital footprint. And you know, for example, one of the things that could happen, I think there was a reference earlier to the Navy medical personnel who came to Baton Rouge, to the Mid-City campus of Baton Rouge General, and they operated a COVID-19 hospital there. We may ultimately have to stand that hospital back up, but without the Navy personnel, and so we're going to be working with all of the hospitals in Region 2 to figure out what sort of staffing we can get from existing hospitals. And so there's nothing easy about this, but it's just much easier to surge in an existing footprint than it is to stand up outside facilities when staffing is the challenge. Yes, sir.
That's your recommendation is that students and adults in schools, age or grade 3 or above, should wear masks as much as possible and depend on the local community. In your opinion, does that strike the right balance between an outright mandate and basically a recommendation that you should wear a mask?
Yeah, and it does, because I view it as a mandate. And by the way, I believe it's recommended for children younger than that to do it as well, but without a mandate. And we'll see whether that is possible. And obviously, the younger a child is, the more difficult it is to get him or her to keep the mask on and wear it appropriately and so forth. But this is obviously anecdotal. I was watching CNN the other night, and they were interviewing a kindergarten teacher, I think it was in North Carolina, who had welcomed her students back. She thought there was no way her students would wear a mask. But she said once she went through it with them one time, they did it, and it hasn't been a problem. So I mean, we will see. But when you look at what Dr. Redfield said about universal use of masks in school settings, I think that the guidance that came from Bessie is exactly right. I interpret it as a mandate for those individuals who don't have some medical condition that makes it where they shouldn't wear a mask. So we're going to have another press conference on Thursday. We'll plan it at 2:30. We'll have another UCG meeting on Thursday as well. I want to thank you for continuing to cover this. I want to ask the people of Louisiana to be as resolute as we were back in March and April. We can flatten this curve again. We've done it before. We can do it again. I have complete confidence, but it is going to take all of us. We all have a role to play, and so I'm asking you to play that role so that we can keep as much of our economy open as possible, so that we can have as much normalcy as possible, and that includes our higher education campuses and our K-12 campuses as well. But there is no doubt we have a long way to go, and the situation is very serious, especially as it relates to hospitalizations. And so we really need to see those numbers go down, the curve start to flatten, and we owe it to one another to be a good neighbor, and we should certainly want to be a good neighbor, not just to the individuals who might contract the virus, but to the healthcare workers who have been working so hard for so long to deliver life-saving healthcare across the state of Louisiana. And we can do this. And finally, I just invite everybody again to offer up in prayer petitions that we would come together, that we would meet the moment. And I would encourage you, if you're able to do so and inclined to do so, to join me in lunch fasting again on tomorrow. So we'll see you on Thursday. Thank you.
And that was Governor John Bel Edwards wrapping up his weekly update on the coronavirus. A big takeaway from today's news conference: he will be extending phase 2 for 2 more weeks. That will go into effect on Friday and continue through August 7th. We'll have more details on today's update coming up on NBC Local 33 News at 5 and 6, as well as on Fox 44 at 5:30. We'll return you back to your regular programming.